Good afternoon. Welcome, everyone. I certainly can see that we're all interested in healthcare. We all want to be healthy, don't we? And of course, healthcare reform is such an important topic, and it's indicative of the importance having your presence here today. We thank all of you for coming. We have Senator Liz Brater and Senator Gilda Jacobs in the room. And if I'm missing other legislators, we will acknowledge you during the program. And we have Jerome Marks from Governor Jennifer Granholm's office and Kathy Strauss from the Michigan Board of Education. And today we are going to be honored with an introduction of our speaker by Senator Liz Brater, our great senator from Ann Arbor. Please join me in welcoming Liz Brater.
Thank you, Veronica. It's always a pleasure to be here at Wolverine Caucus. This room is packed today. It's clear that this issue is very important to all of us, and we're in for a treat because Marianne Udow is a person who can explain a very complex matter and make it understandable, which I know since, for a group of U of M alumni, you're used to taking complex matters and picking them apart and putting them back together again. So we're in for a treat this afternoon. Marianne Udow-Phillips is currently the director of the U of M Center for Healthcare Research and Transformation, which is abbreviated as CHRT. Do you have a way to pronounce that? CHRT? And the U of M is obviously a leader in providing expertise and spinning it off to public policy makers, and so we really appreciate this opportunity to hear what you're working on today. And before this assignment, Marianne, as you know, served as director of the Michigan Department of Human Services from 2004 to 2007, and that is something we're very grateful to you for your service during this difficult period in Michigan history of trying to provide social services and keeping the social safety net intact. She came to state service from Blue Cross and Blue Shield of Michigan, where she served in various roles for over 20 years, most recently as Senior Vice President of Healthcare Products and Provider Services. At Blue Cross, she had responsibility for the social mission, health policy, data analysis, and care and network management programs for the traditional and PPO products. She also served as Senior Vice President and Vice President of Plans and Operations for Mercy, Alternative, and Care Choices. Marianne has a master's degree in Health Services Administration from the University of Michigan School of Public Health and currently serves on the Dean's Advisory Board. So please help me welcome Marianne Udow-Phillips. Thank you.
It's wonderful to be here this afternoon and to see such a great turnout, so many old friends, new friends. It is clear that healthcare is compelling, and maybe the healthcare bill is a little confusing. So we have, I think, an opportunity together to maybe demystify what's in the healthcare bill, and that's certainly going to be my goal today. We have a mix, I know, in this audience of some folks who could give this talk for me, and others who this is really new territory to. So I'm going to try and sort of gear it to both of you and really start with some level setting so we all understand the basics of the healthcare reform bill and how it's going to likely impact Michigan. I know many of you are really going to be most interested in the questions you all have and the discussion part of this. So I'm going to try and keep my remarks to 20 to 30 minutes at most. And then spend the rest of the time, hearing from you as to what's on your mind and what you would like to know about this law and about where Michigan might head as a result of this law. 2 minutes on chart before I talk about health reform. In your packets, you do have a brochure about our organization. We are actually a partnership between the University of Michigan and Blue Cross and Blue Shield of Michigan. We were established almost 3 years ago now to look at ways to improve the quality, the efficiency of the healthcare system, and access to healthcare. And one of our important roles that we feel we like to serve every day is to share public information and education so policy can be made based on information, based on data, And a lot of what we're about is really trying to produce useful policy information for policymakers like those of you here in this room. So I encourage you to take a look at our website. We didn't have enough of all of our printed materials to give you copies of everything. There's a lot more on there about the cost of health care in our state, how we compare to all 50 states. There's a lot more on there about the chronic disease burden in our state. There's information on there that we just released about what the coverage picture looks like today in the state of Michigan. And I think all of that information can be very useful to all of you. If you would like print copies of it, just let me know. But it is all on our website. All right, so the title of my talk that Veronica asked me to talk a little bit about was, what does healthcare mean for the health of Michigan citizens? And I have to sort of modify the title a little bit right at the outset, because translating what this bill, what this law is all about into health is a few steps down the road. We don't really know what it's going to do for the health of Michigan citizens, because the focus, quite honestly, of this law is on insurance coverage. And although we know from the research that insurance coverage is important in terms of health status, it is by no means definitive in terms of health status. There are many other issues that interrelate with health status that really define the health impact on people much more than the coverage issue. And so the first thing I would say to you is that simply having insurance coverage is not enough to improve health. And this law is really about, for the most part, insurance coverage. You'll see there are other things in there as well, but many of those other things are not where the dollars are in the law. In fact, as you see, I'll go through this, there are about, many of the provisions in the law are things that are described. They are authorized but not appropriated, which means they have no money attached to them, but a lot of the language in the law is devoted to describing them. And so what they really are somebody's very good idea. The Congressional Budget Office calculated that $115 billion is referenced in the law but not appropriated. And so many of the things I talk about today are things that we hope will happen and that are described in the law, and you might hear in some of the messaging about the law, but in fact the money is not yet appropriated to actually carry it out, and I'll talk about those as we go. So important to keep in mind. The vast majority of the dollars, the almost $1 trillion that you heard about with this law, is really about expansion of insurance coverage, and that's what I'm going to focus on. I'm going to tell you how we think it might affect the state, and that's where a lot of the effort is happening behind this law. This is seminal legislation. I would just tell you at the outset, because there have been a lot of myths, surprising out there, about the law. And I do want to tell you that really the fundamental provisions in this law are pretty moderate, center-of-the-road provisions. There have been statements made that this is socialized medicine, that this is just this most radical transformation of healthcare in the country, and that really simply is not true. The provisions that are in this law build on the current system. As we go through this, I think you'll see it does not radically transform where we are. It really incrementally in a significant way, improves where we are in terms of coverage. But it builds on all of the existing structures. It builds on Medicaid, it builds on Medicare, it builds on the private coverage that we have in this country. This is not a Canadian-style single-payer system, much to the dismay of some who've really advocated for that approach. It is something that is even less radical, frankly, than President Nixon proposed many, many years ago. So this is a center, maybe center slightly left law that is something that is a significant change. I know that President Obama said he wanted to be the last president that did health care reform. He may not be the last president. There's still room in here for new things with regard to health care. So let me start, and what I'm going to cover today is included in the materials we gave you in your packets. There are two documents I'm going to go over today. They are the policy brief that is intended to demystify the law, and then there's the issue brief that gives